Hi, good afternoon, everyone. Hope you are all doing fine. Uh, Chirag Bari this side from ISWAN. We are here with yet another episode of ISWAN Talks, and this time we will have Dr. Z Belani, who is from the Blue Shield Medical Clinic, and who will be sharing very useful tips for our seafarers regarding the blood pressure and diabetes and how can you look after them, these things on board ship. What are the risks are there in that, and how you can mitigate those risks. So we'll be very interested to discuss all these things with Dr. Belani today. We are expecting him to join at any time.
Good evening, Captain Bari.
Good
Nice to see you.
Good evening, sir. How are you, sir? Good to see you again.
Yeah, nice. I hope all healthy, safe in your family, colleagues.
Everything is going good, sir. By God's grace, everything is fine, and we really hope that everything is good at your end as well, sir.
Yeah, all well. Thank you. And thank you for inviting me to this forum.
So this is our honor to have you here today. I was just mentioning about that we have Dr. Z Belani, who is from the the Blue Shield Maritime Clinic in Mumbai, and he'll be sharing with us very useful tips about how can a seafarer look after their blood pressure or diabetes issues, because these are quite of very common ailments. We'll find it in in the main public as well, and going on board with these kind of ailments, how can you look after yourself? What are the right practices you can follow that you can work along with these ailments, and as well as how you can avoid also that these ailments can come to you in your life. So we are very pleased, sir, that you are able to join us today from your busy schedule. Welcome once again, sir.
Thank you.
Right, sir. So we're just starting off this thing, and in the last session we had in the month of February, and we had Dr. Corinne Idnani from Idnani's Medical Clinic, and she spoke about how to remain fit, looking after your physical fitness is important, and how you can look after those special simple tips about how you can look after your physical fitness on board. So which was very helpful, and a lot of seafarers benefited from it as well. And today we are taking that one step ahead to talk about diabetes and the high BPs and issues around that. And so your medical clinic is serving to seafarers from a long time, in fact, from a number of years. And a number of seafarers comes to you on every day, every month basis. And so how do you find these numbers, basically? Do you have any data to suggest that how many seafarers would be suffering from these kind of ailments who are working on board?
Well, we do not have exact statistical data, but based on our average daily selection and also our inspection, we find that about 30% of our attendees in a small practice like ours have hypertension or blood sugar which are elevated, or both.
So that's
It's a very high number.
Yeah.
It's a startling number. Way back in 2014, India was number 2 to China in diabetes, but today India is the capital of diabetes in the world. We have the highest number of diabetics in the world. So that's not a very nice distinction that we have.
Absolutely. But this is really very alarming situation if you look at diabetes, and it's a lifelong thing. It's not a very, like, it comes and you can treat it very easily. So it becomes a lifelong disease, in fact.
It's a lifestyle disease, as they say. And once it sets in, it's not curable. It's only manageable. So yes, the first objective is to make sure and prevent the onset of diabetes. So what my colleague Corinne spoke in the last session is a very important aspect of preventing both diabetes and hypertension, is to keep fit. physically fit, and of course, there are lifestyle modifications which we'll talk as we go further in the session today.
Absolutely, sir. And so it is critical that these, that the seafarers, before they embark on their voyage, before they go on board ship, they
Mhm.
can maintain their proper medications and their diets in order to ensure that these critical ailments remain in limits. So, can you please share some of these insight as to how the seafarers can look after these ailments on board ship?
The biggest challenge is acceptance. One. Number two, when we get a declaration from each seafarer, none of them, I can say none of them without exception, would ever accept that he or she has diabetes or hypertension. Once we detect that on examination, then they come over, yes, sir, but it is controlled, not controlled. So, one, the acceptance. Number two, denial. Because in India, and like most of the countries, we feel if there is no fever, there is no pain, we have no disease, which is not a fact. We know that diabetes and hypertension are called silent killers. And this is what it is. By the time somebody has symptoms, it's too late to turn the clock back. The complications have set in, the heart is enlarged, or the issues with the heart, the kidneys are damaged, the brain is not receiving enough blood supply, the eyes are affected. So, point is not to be in denial. Once detected, accept it. One, the seafarer is not denied a job on board with diabetes or hypertension. So all seafarers should understand when they give us an honest declaration, it's easy for us to help them control this lifestyle disease rather than find and then say, oh, wish we had done that, wish we had done that. Time is always a constraint for giving in a fitness. So last minute, then we have to deny fitness to them. So there's 2 days become critical. That is one. Number two, they should understand that fever and pain are not the only two main presenting symptoms of hypertension or diabetes. Various factors come into play how to prevent. Over the decades, when I was a child and growing up, we had a lot of outdoor activities. I think with the advent of VCR in the early 80s, people started to become couch potatoes. Then came the mobile phones. Then came internet. Then came computers. Then came the games that we have. Then came WhatsApp. Then first came the BlackBerry Messenger. Then came WhatsApp. Now we have Instagram. We have Twitter. We have say whatnot, and I don't even know what social media platforms we have today. So we don't even interact with people. So that's a social issue. But definitely we don't go outdoors. We don't walk. Is good enough. I know technology. I can talk to my son in New York on a daily basis. Wow, we could not even make a call in when I was studying in the US in mid 70s. My parents had to wait for hours to connect to me, and it was so expensive. So technology has its advantages, but I think we are abusing or exploiting it wrong way. So we need some physical activity which has gone down, and we also have started to eat a lot of junk food. Our dietary habits have changed a lot. On the run, stress, okay, coffee, burger. So it's a very high glycemic index meals that we tend to have, particularly in India. In the West, they are careful. They have a lot of protein, and then they add you'll see, even if they give red meat, beef or lamb or anything like that, pork, they will give a portion of green vegetables. And they may give potatoes. But the bigger portion is the protein. Whereas if you see in India, we have first rice or chapati or bread, or on the go, we have vada pav in Maharashtra, Mumbai, or we say, okay, we'll have a burger, now the modified vada pav, the westernized style of vada pav. So it is all one processed food which has a lot of salt. Number two, carbohydrates in the bread, the ketchup, a lot of sugar and salt, mayonnaise, again, a lot of sugar. So there's so much of carbohydrates that we are having.
Absolutely. I think you very, very rightly pointed out, sir. The inactivities, the physical inactivities is very common, especially among the kids, among the growing childs. they're mostly on the internet or maybe chatting with their friends or and not been able to do much around the socializing with their colleagues. And this has also been reflected on board. People
Mhm.
find themselves sometimes not taking part in much of the activities and isolating themselves as well. And we discussed that in the last episode as well about the same. So physical activities is very, very necessary in a day, with Dr. Saab is saying. So I appeal to all seafarers who are listening to us in this episode to please devote some time to your physical activities on an everyday basis,
And
which
it's
can.
not that we are saying you must be exercising for an hour. 20 minutes is a good amount of effort if you walk fairly briskly, and it will take care of most of the health issues, keep you fit, and also it gives a lot of mental pep. When we put in physical activity, our brain produces what is called endorphins, which are the natural body morphine-like substances. So the same high as morphine gives is what we'll get if we exercise.
Yes, no, definitely. I think, so seafarers on board ship, that they might find it difficult to do a brisk walk or something.
Mm.
I think, can they do some physical exercises, some light exercises in the cabins, or
Yeah, of course.
right?
Now you go on YouTube, they'll get nice stretches. You can do some yogic exercises which are not very tough. These are very important things. And the other aspect is those who are diagnosed with diabetes and blood pressure. Again, there are no symptoms. So they should not discontinue their medication unless a doctor tells them. But what happens, a lot of people we have found, they'll go to a mall when a ship calls a port and do a blood pressure check, which is very common, and find their blood pressure is normal. They say, then I don't need medication. That is not the case. Medication is keeping your blood pressure in control. So please continue medication till your doctor tells you not to. Same is for diabetes. So there are no symptoms, there are no issues. So continue your medication. Both the
Absolutely.
things do not discontinue unless a doctor has advised you. And
That's
when they
very.
go on board, they should carry at least, uh, as we say, 1.25x of the duration of the contract. If it is for 6 months, then they should carry medicines for at least 7.5 months. And we have seen in the times of COVID, crew change was so difficult. Some of the crew had to stay on board for almost double their contract time.
Right.
So these are some challenges we have had with these lifestyle diseases.
No, that's very, very important, sir, to know that that the seafarers needs to carry the proper vaccine, proper medications for these
Mm.
ailments. Do not deny, accept that you have an ailment, and then looking for a cure for that or maintain your lifestyle.
Yeah,
This is what Dr.
absolutely.
Sir is just now, trying to brief you all about. That accept the fact that an ailment is there, and then only you can work on to improve your lifestyle and to manage that ailment. And so, just one thing more, I just wanted to ask you that what are the kind of kits that they can carry, like insulin kits or any other thing which with them when they go on board? Because as you rightly mentioned, that the seafarers are not denied jobs if they have hypertension or diabetes. But how do you manage that on board ship? Like, what kind of kits would you advise the seafarers to carry with them before they join ship?
So those who are on insulin are definitely not eligible for a sea job. But there's a very small microscopic proportion of seafarers that we see who are on insulin because that means a very serious style of type of diabetes. So most of them can be managed by medication. So they should carry the very easily available glucometers, very affordable with adequate strips. And I would check myself at least 2 to 3 times a day, first to find a pattern that what is causing a spike or a surge in my sugar, so I can avoid that food. On a ship, you cannot be choosy like at home. You cannot say, I don't want this, I don't want that. So perhaps you can only modify and say, this is, I'll have small quantity of this, a larger quantity of the protein, and then check your sugars and then make a note of what is giving you the best results. So a glucometer with adequate number of strips and pins, which are called stellates. For blood pressure, carry your own electronic BP instrument, which is not always very reliable. But before you leave shore, have it validated in a doctor's office. If my equipment is saying 130 by 80 and yours is saying 138 by 86, it's a small margin of error, and you are in the small margin, and you can rely on your blood pressure instrument.
Right. So I think that's very important, sir. And are these medicines or are these meters are available on board, sir?
There, unfortunately, some of the vessels that we manage for radiomedical advice over the years are carrying this. But when we get odd call from a vessel and we say, okay, we want a blood sugar check, oh, they say we don't have a glucometer on in a medical chest. However, there are some. If it is an Indian or a there's Chinese crew, we know somebody will be carrying in their personal kit. We do find it, but it's a hardship. So it's best to carry your own personal kit. They are very affordable.
Absolutely.
They're very affordable. 900 rupees for the glucometer, and chillets are not expensive. Even the strips are not expensive. And this is so important to manage diabetes, which is a killer, which is a silent killer.
Right. So again, appeal to every seafarer to please do a thorough checkup before you join ships. And if you have any disease, any ailment such as that, please carry proper kits with you. Please carry proper medicines, sufficient medicines to ensure that it doesn't run out, and don't stop your medicines in between. This is what the advice given by Dr. Belani just now.
Absolutely, you have concluded very well, Dr. Captain Bari. One more aspect I would like to emphasize. Once the seafarer gets back home, within a short time after he settles down, meet his family, go and see the family physician and make sure that everything is in order. Because it's not only for a employment medical check that you should be fit. You need to be fit for yourself, your responsibility, your family. And this is the message you will also give to your children, that health is important and I'm serious about my health and I'm looking after it.
Absolutely. And so you just started mentioning about some of the advices for the seafarers on how they can look after their lifestyle changes. So if you can just brief a little bit more about what are the things they can change in their lifestyle in day-to-day life, so that they can mitigate these kind of risk.
So there are certain, as we say in mnemonics, white poisons, which is sugar, salt, maida, flour, dairy, and rice. So restrict all these. While we are watching TV, we'll have wafers which are salted without realizing that we have had so much, I would say, invisible salt and carbohydrates because we are having wafers. Yes, please do have, but limit it. And if you're a diabetic or a hypertensive, be aware that this has got salt. Make sure then you dust away the salt, salted nuts. So when we have ketchup, we feel it has only got sugar, but when you read the content, it's got as much salt for preservation. So salt, sugar, flour. So 5 white poisons I said: salt, sugar, dairy, flour, and rice. So please be very careful. Limit the quantities and also the food portions. If they can be reduced by 15% and keep the weight in check, I think we'll conquer both diabetes and blood pressure.
Thanks, sir. And sir, there are also a lot of myths about high BPs and high hypertension and diabetes. I would like to take some of them with you just to clarify among the seafarers or those who are listening to us today, that some of the people think that I eat a lot of sugar, and is it necessary that they will definitely get a diabetes if somebody has a sweet tooth, or is it more belong to hereditary and your lifestyle things?
So diabetes is not a hereditary disease. It is a familial disease. It runs in families because the lifestyle is a lifestyle disease. So whatever is the lifestyle in a family, the children will follow the same. So yes, somebody who's been having excessive sugar is very likely to develop diabetes, because if you ask me this question 35, 40 years ago, my answer would have been no, because we put in a lot more physical activity. But today, yes, we are not putting in that physical activity, and our food habits have changed. Our food type of food has changed. The fast food with its preservatives and carbohydrates that we have changed. So yes, anybody who's having a lot of sweets and carbohydrates is likely to get diabetes.
Sure. And there's also a myth around that while you have diabetes or high BP, is it safe to do exercise? People say that.
Absolutely. When I advise my patients or seafarers, I say you have to control diabetes or blood pressure. The first thing is exercise. Second is diet. Third is medication. Most of the people take it the other way and put exercise at the bottom. Say, oh, I have some patients. Oh, let's have one scoop of ice cream. अरे एक गोली और ले लेंगे. Those who are on insulin, 4 unit और लगा लो. That's not the right thing to do. So exercise, diet, and medication in that order. Please, I'll repeat: exercise, diet, and medication. Exercise is the most important thing. Diet is next important. Medicine is just the icing on the cake.
Okay, that is very, very, very well cleared, sir, right now, and I hope this is very, very useful for the listeners as well. And so people normally say that I'm on the borderline of diabetes, and so do they need to worry about it? At what level do they need to worry about and start seeking some other medical support?
So this is again another way of denying to oneself that I'm not a diabetic. I'm at the borderline. Yes, you're at borderline. Control it. Don't let it progress. So we have seafarers who will not have dinner, not have breakfast, and at dinner or at breakfast time, they will have a medication to control the sugar. Unfortunately, shipping companies have now started to conduct tests which will do an average of the preceding 90 days what has been the level of sugar. So we will find out, though the blood sugar is low, but that average, which is called HbA1c in medical parlance or GHB, will be high. So we know the person is diabetic. So
Right.
yes, borderline, time to take to be red alert. Is the red alert? This is time to take action.
Very
Let
rightly
it
said.
not progress.
Yeah. I
So
think
how
so.
do they say borderline? It's all self-created, self-justified issues. Do not mind my saying and going to another issue, alcohol, which is bad for both diabetes and hypertension. So uh, I have friends who say, "Oh no, I don't drink every day. I only drink when I socialize." And I usually take 2 drinks, but sometimes my job is such I'm socializing. I'm the CEO of a company. I have to entertain. When I'm forced, I have maybe 3, 4, sometimes 5. So I heard this long over. Then one day I just happened to ask one of my friends, "How often do you socialize in a week?" He said, "यार ऐसा job है 5 to 6 days to socialize हो जाता है." So you're drinking every day, but telling yourself, I'm a social drinker, I drink 2 drinks, but you're having 5 large because you are socializing. So these are some of the barriers we need to break. Be realistic with ourselves. You may be able to, as a diabetic, have maybe one mango a day in the season and not create a surge. I may not be able to do the same. My body physiology is different. So that's why I say you have to have a glucometer, see your patterns, eliminate food items that will cause a spike and surge. It
Right.
is so individualistic.
Absolutely. And so there is also this thing that the people who are overweight and who are obese or not necessarily in the limits of their BMIs, would they have to worry too much about their hypertension and diabetes? How these are both things are correlated with the.
Absolutely, BMI is directly proportional to the risk of diabetes and hypertension. There are exceptions. Winston Churchill, most of the people will know, the Prime Minister of UK during World War II, obese, used to smoke. His picture will come with usually a cigar. Used to drink and used to say, I drink, I smoke, I eat well, and he has no issues. He died not due to any medical disease, he died due to the complications of a fall, due to a head injury. My late mother-in-law, she was obese, typical Punjabi lady. She didn't have blood pressure. She didn't have sugar. When she had medical issues, my doctor colleagues were very surprised that she had no blood pressure, she had no diabetes. One look, but these are exceptions. These are exceptions. And again, during her time, she has put in a lot of physical activity. So her physiology is different, her metabolic buildup is different. So let's not go by exceptions. Yes, a BMI is a direct indicator and is directly proportional to the risk of hypertension and diabetes.
So I think with this, I think we would like to just sum up this session, I think, which is very, very useful advices, sir, what you have given to us today. Bottom line is that people need to just go for simple exercises. No need to go hit in gyms every day.
Absolutely.
Cannot just go in for normal 20 minutes of brisk walk every day, or do some stretching exercises in your cabins if you cannot go for a walk, or if you cannot do any other thing. uh, just 15 to 20 minutes dedicatedly, if you can put in your daily schedule. Start adapting to your new lifestyle. Avoid the whiteness which Dr. Saab just mentioned about sugar,
So
rice,
discretion
salt.
in diet. So
Yeah,
discretion in diet. First is exercise, weight control, discretion in diet. Thirdly, if it is still there, effective control with medication.
absolutely. I think you can overcome all these things. Look after your lifestyles, because the things are changing very, very fast nowadays. We are not having a lot of physical activities as
Mhm.
our elders used to have in their lifetime. We are more of kind of becoming tech savvy people who are exploiting the technology,
Mhm.
and as we have learned in this session. But there is a way out in here. There is a hope in there that we all can look after our own lifestyle changes and also manage the risk of these ailments. And so with this thing, I think I would like to sincerely thank you, and we're very, very grateful to you for very simple tips which you have given us today. And I would also like to invite now the seafarers who are listening to us to please put up the questions in the chat box. And if you have any questions, please put it up now. And we'll be more than happy to take it up in the next couple of minutes with as Dr. Belani is among us. It is a wonderful opportunity to have him today with us.
So while we are waiting for the questions, Captain Bari, one request to all seafarers who are participating and they can dissipate this information, please be honest in declaring your health. It is for your benefit. No doctor is going to deny, no company denies a job because of hypertension or diabetes.
Thank you, sir. So one question before we get anything more from others is about the seafarers, if they have been put on insulin by their family doctor. Uh, I think they can still go on board ship and work. Or is it like a difficult task for them to work on board ship with the insulin?
Insulin has the risk of hypoglycemia, which means a sudden drop in sugar, which can cause loss of consciousness. So, insulin is clearly indicated in guidelines as a condition which precludes a seafarer from going on board. So, if
Okay.
let's say I'm the seafarer, I'm put on insulin. Most of the times, it will be a short duration to control my high sugars, and after a particular time, let's say a week, 10 days, 2 weeks, I'll switch over to oral medication. It is possible. So, but those sometimes there are some, as I said, a very microscopic proportion of seafarers who would need insulin on a regular basis. Those are the
Okay.
ones who will not be able to join. There
Okay.
have been cases who have said, no, I don't take insulin and there's no way to know. And we
Right.
have had deaths of very senior officers on board. And when they have rummaged the cabin, they found insulin. And it's so sad that we lost life because of the complications of insulin therapy.
Right. And I think one appeal also, to every seafarer, to don't stop your medicines on your own. Take the advice of your family
Absolutely.
doctor or the medical doctor, and before you stop any medicines, we should not become doctors on our own.
Mhm.
Very, very good advice. So I don't see any questions today in our this thing. At the moment, we don't have any more questions. And but at the same time, we would like to again convey our sincere thanks to you. I think it's a very, very simple session and very, good and useful advices which have been given out. I'm sure this will help a number of seafarers to look after their own, health when they are on board.
Thank you, Captain Bari. It's been a privilege and an honor to be on this platform and be able to talk through this to so many seafarers at the same time. Thank you.
Absolutely. Thank you
Wishing you
once
all
again.
good health and safety.
Thank you so much, sir,
Take
once
care.
again for
Bye bye.
being there. Bye. Take care.
Bye.